Lights Out in the Open panel right now. Clarence Page with his mic on, yes. Tara Wall, Rachel Maddow. So Clarence, should this be mandatory? Made mandatory by state government?
You know, what troubles me is making it mandatory before the public is adequately educated, because I saw what happened with Roe versus Wade, which I personally support as a decision, but I saw the backlash, which we're still feeling politically across the country, because it was imposed on the country. It's a very personal thing. Whenever government gets into something as personal as, say, 12-year-olds, like my 12-year-old niece, you know, mandating that she's got to get a shot that many people think is connected to sexual promiscuity. I don't think it is, but because so many people think that, we obviously need a lot of public educating out there. So it troubles me to do it too quickly.
Public education, there is the strong view that you're promoting promiscuity. There are people that think, since this vaccine has only been around for 4 years, that it really won't convincingly reduce rates of cervical cancer. So what difference is it going to make if there's a time lag before you make it mandatory?
Well, here's the thing. If we were talking about a vaccine for any other kind of cancer, as a person in your previous segment described, we would be singing hallelujah right now. But the fact that this is a disease that is spread by sexual contact, human papillomavirus, which leads to cervical cancer, all of a sudden we get hysterical and lose the ability to think reasonably about this. Once you bring up sex, we lose all public health rationality about this. And so I think that really what you need to consider is whether or not this is going to be treated as a public health and safety issue, or whether this is going to be another thing about which we have a hysterical sex conversation involving teenagers, because we can't have that debate.
Of both of those.
This is listen. You talk about not having the buy-in of the public, not having the buy-in of the legislature. The governor did this on his own. The governor, whom I respect, and actually he's my governor. I voted for him, but he's wrong. He has been a very good conservative governor, but he's wrong on this issue. As my mother, you know, says, a person can be sincere, but they can be sincerely wrong.
How can
there was no parental. You're usurping parental rights. You're usurping the legislature. Make it an opt-in as opposed to an opt-out. There is an opt-out provision, of course, but why not make it an opt-in as opposed to an opt-out?
Would you do that for measles?
And
would you do that for rubella? Would you do that for polio?
This has to do with a very sensitive, issue that is a family issue that parents need to discuss with their children amongst themselves, and not to have the government impose upon them. That's not for the government to decide.
If you want to see how it's working so far, I want you all to look at the screen right now, because this is a staggering statistic. This is the incidence of HPV hitting young kids in this 14 to 19-year-old age group. We know that about a third of kids that are 13 to 16 are sexually active. So do you think parents have their heads in the sand?
Of course, yes, parents have their heads in the sand about sex and drugs. We know that. But there's also the question about parents who want to take responsibility for their kids, should they be entitled to have opt-out or opt-in choices? I think that's really what's at issue here. You talk about rubella and several other contagious diseases, which you can catch without having sex. I mean, there is a reason to want to control a contagion that travels in the air and to mandate that. When you're talking about something that is more personal, well, look at the figures.
It's endemic. If you're a teenager having sex, basically you're going to get HPV.
Just to play devil's advocate, I'm very good at.
If you're not having sex, there are plenty of teenagers out there who have had discussions with their parents who choose to remain abstinent or virgins until they're married.
But you know what the manufacturers, hang on one second, the manufacturers of vaccines say that's a good thing, because they said that the vaccine is more effective when you're inoculated before you start having sex.
The other factor is, and my mother is a nurse as well, and some of the issues that are being raised is how new this is. It hasn't been tested and tried. It needs to be given some time. The other portion, again, opt-in, not make an opt-out. Let parents decide. This is the government assuming parents don't know what's best for their children. I think that's a little bit elitist.
Okay, gang. Tara Wall, Rachel Maddow, Clarence Page, thanks for all your perspectives. We got a really